Now we will analyze the role of the 5HTTLPR polymorphism on SSRI pharmacodynamics. This illustration divided into three logical panels. Panel 1 details the genetic landscape. Our target is the SLC6A4 gene, responsible for creating the serotonin transporter, or 5HTT. There is a common variation in its promoter region called 5HTTLPR. You can have a long insertion L with 16 repeats or a short deletion S with only 14. However, there is a crucial wrinkle. A single nucleotide polymorphism, or SNP, adds a layer. This creates specific alleles, LA, which is high expression, and LG, which is technically long but functions like the short S variant. This definition is critical. Moving to panel 2, we map these genotypes to functional expression levels. This dictates how many transporter proteins you ultimately produce. We categorize this into functional groups. The highest expression group is functional LL, meaning LA. The functional low group includes functional SS and functional LS patients who carry the functional poor LG variant. This visual ranking shows a clear cascade. Functional LL is greater than LS, which is greater than SS. This determines the baseline density of drug targets available. This brings us to the clinical payoff in panel 3, the pharmacodynamic impact. Crucially, SSRIs work by selectively inhibiting the serotonin transporter, preventing the reuptake or recycling process to keep mood-enhancing serotonin active in the synapse. Because of this mechanism, baseline transporter density matters. Look at the high expression synapse on the left. These patients have a dense baseline of serotonin transporters. Since SSRIs target this, the drug have ample targets to bind to. This facilitates a faster reuptake block, achieving optimal serotonin levels in the synaptic cleft, correlating directly to better response and potentially faster onset of action. Now, look at the functional low expression synapse on the right. These patients have sparse baseline transporters. SSRIs have limited targets. The reuptake block is slower and less effective, resulting in only moderate serotonin cleft levels, which is associated with a poorer response and potentially increased side effects, such as GI issues. In summary, 5HTTLPR tells us the baseline targets density matters. Functional high targets lead to optimal efficacy. Limited baseline targets limit antidepressant success. Understanding this polymorphism moves us towards personalized psychiatry and better outcomes.